The world wasn't ready, but together we are. Vaccinating the world against COVID-19 poses monumental logistical and cold chain challenges for governments, NGOs, vaccine manufacturers, and distributors worldwide. We've all come together to discuss, debate, inform, and network so that we can all deliver hope to the global community. Abu Dhabi's strategic location is a major advantage in providing a hub and spoke model that can align vaccine deliveries according to the ability of destination countries or organizations to absorb them, making sure every vaccine counts. Abu Dhabi will ensure this through its transport with Etihad Cargo's direct connections to Asia, Europe, Africa, and the US. Storage with Abu Dhabi Port's advanced 19,000 square meter ultra-cold storage facility. Handling that provides end-to-end logistics support, clearing, and freight management. Demand planning that delivers digital track and trace of vaccines throughout to the cold supply chain. Sourcing that leverages the bulk purchasing power of the UAE to support humanitarian initiatives. Distribution using SkyCell's award-winning temperature-controlled container solutions. And last-mile delivery through agreements with leading global freight forwarders. The sooner we come together, the faster we can combat the pandemic. Because even in the darkest hours, hope will prevail.
Your Excellencies, distinguished guests, ladies and gentlemen. Assalamu alaikum and good morning once again from Abu Dhabi, and thank you for joining us virtually for day 2 of the World Immunization and Logistics Summit under the patronage of the Ministry of Foreign Affairs and International Cooperation of the United Arab Emirates and hosted by the Hope Consortium. My name is Yusuf Abdullah, and it gives me a great pleasure once again to be your MC for the second day of this summit. With that said, ladies and gentlemen, today we will hear from influential leaders as they share their insights and experiences around key challenges in vaccine administration and equitable access, before moving into more deep dive focus sessions around the Middle East, Africa, and Asia. Please do remember to visit the virtual exhibition and networking areas and take part in the challenge chat rooms. Now, as a reminder, if you do require Arabic to English translation, please click on the headset icon at the lower right of your screen. And now, we would like to kick off day 2 of the World Immunization and Logistics Summit with an opening address from His Excellency Abdullah bin Mohammed Al-Hamid, Chairman of the Department of Health, Abu Dhabi, on innovation, ingenuity, and inclusiveness, finding the human solution to a global challenge. Your Excellency, welcome to the stage.
It is our pleasure to virtually welcome so many of you from around the world to Abu Dhabi for the first World Immunization and Logistics Summit. Towards the end of 2019, many of us were planning for a year of places to visit, people to know and work with, and a professional and personal growth to be achieved. All of this has changed due to the one of the smallest organisms on Earth jumping from one species to another. In 2020, and so far this year, COVID-19 global pandemic continues to be one of the largest and most complex global challenges in the modern times. It affected many people, countries, and entities, lives and livelihood. In equal breath, it's incredible to note how the world had come together to tackle this issue that transcends national borders, communities, and continents. Under one unified goal, countries around the world have worked tirelessly and taken the necessary actions to ensure that all segments of their communities and neighborhood have dependable and timely access to solutions that reduce the impact and put humanity on the way to recovery. Pandemics, like other crises throughout history, have been valuable opportunity for accelerating scientific innovation and adopting new technologies, ways of thinking and processes. This was demonstrated with the shining example of the science and scientists around the world coming together to develop several safe and effective vaccines within 11 months of the start of the pandemic. Here in Abu Dhabi, we continue to be part of this effort through the For Humanity campaign that allowed more than 32,000 volunteers to be part of two of the largest successful global vaccine clinical trials. Not only that, we have put our humanity capital and infrastructure into designing and deploying solutions for Abu Dhabi and UAE, but we continue to extend that to the world. We will also continue to invest in research and innovation to support the fight against the pandemic. And the future development of Abu Dhabi's health sector will continue to be shaped by our current and ongoing focus on science, research, and innovation. Our wise leadership has prioritized the safety of the UAE community by providing all members with the necessary healthcare and livelihood support throughout the pandemic. Moreover, this national support should go hand in hand in supporting the wider world, underpinned by the strong belief that no one is out of this pandemic until everyone is out of this pandemic. This was evident by over 250 international destinations that we sent humanitarian aid to, translating into over 80% of the total global aid coming from UAE. The global cooperation in the fight against the pandemic is of paramount importance, and we believe the HOPE Consortium is a catalyst for even greater cooperation between partners worldwide. The Department of Health Abu Dhabi is proud to be spearheading and funding partner in the HOPE Consortium in supporting the urgent distribution of the necessary vaccine worldwide. We strongly believe that no one can do this alone, and we are implementing the seed of international collaboration. Together, we have a capacity of handling over 6 billion doses of vaccines this year. And we are already increasing the capacity of over 18 billion vaccine doses by the end of 2021, from production to people, anywhere in the world. This capacity is being built with the vision of Abu Dhabi to becoming the top regional and one of the biggest life science hubs globally. We are open to the world and to serve the world. We look forward to using this platform as a springboard to even more partnerships in the near future. Throughout collaboration and innovation, we look forward to paving the path towards a more resilient, healthy, and prosperous future for humanity, allowing us to plan to see new people, visit new places, and build on the growth and resilience that we have developed last year. Thank you.
Thank you to His Excellency Abdullah bin Mohammed Al Hamid. And now, ladies and gentlemen, for this morning's keynote address, I'd like to welcome Robert Mardini, Director General of the International Committee of the Red Cross, to the stage to discuss equitable access to vaccines, a humanitarian imperative. Mr. Mardini, the stage is yours.
Excellencies, ladies and gentlemen, I am very pleased to have this opportunity to address this distinguished virtual gathering today on an issue that is of critical importance to all of us right now: global vaccine access. A special thank you to the HOPE Consortium for the invitation and for organizing this inspiring initiative. As we all know, COVID-19's relentless march around the planet has affected everyone, everywhere in one way or another, but very unequally. People and communities affected by armed conflict or other situations of violence have been among those hardest hit. People living in places like Syria, like Yemen, or northeast Nigeria, for example, where less than 50% of healthcare facilities were functioning even before the pandemic struck. People where the pandemic is one more deadly threat among many others. These are the people who are the main concern of the International Committee of the Red Cross, ICRC. Together with our partners in the Red Cross and Red Crescent movement, we have stepped up our COVID-19 response worldwide from the outset. This goes well beyond addressing the immediate effects and threats of the virus. The pandemic has made many existing humanitarian needs very much worse. Long-term support will be needed to rebuild livelihoods, for example, and for mental health and psychosocial problems. Now that COVID-19 vaccines are being rolled out, there is a new glimmer of hope, but also many more challenges, old and new. Continuing vaccine inequity is one of them, a problem that Dr. Tedros at WHO has rightly called grotesque. Of the vaccine doses given globally, roughly 3/4 have gone to only 10 countries. At least 30 countries have not yet injected a single person. The warning signs are hard to miss. None of us will be safe until everyone is safe. That's why the initiative by the HOPE Consortium is so timely and so important. Ensuring equitable access to vaccines is a major concern for the ICRC, particularly for people in conflict-affected areas where we work. We are thinking here of people living in hard-to-reach areas, those on the move or displaced, detainees, and people in otherwise forgotten communities. We are thinking of the 65 million people estimated to be living in areas under the control of non-state armed groups, people excluded from basic state services, including healthcare. In some cases, we will directly support national vaccination campaigns and/or immunization services in areas covered by our operations or in hard-to-reach areas at the request of a Ministry of Health or a national society. This goes beyond just the COVID vaccine. It is vital that routine immunizations and essential health services be maintained and strengthened as well. In other cases, we will capitalize on our privileged contact with some 465 armed groups worldwide and our role as neutral intermediary. In this role, we are ready to facilitate so-called last-mile access for certain populations across front lines, including in hard-to-reach areas under the control of non-state armed groups or non-government-controlled areas. To give just one example, in Somalia, together with the Somali Red Crescent Society, we are planning to support authorities in the distribution of vaccines to 7 places of detention, holding about 1,000 detainees in locations that are difficult to access. The summit is rightly highlighting the need for cooperation and collaboration in the massive task of global vaccine distribution. Likewise, for us at the ICRC, working in partnership has never been more important. Our primary partners are within the Red Cross and Red Crescent movement, principally national societies as well as the International Federation. Community engagement with and through national societies will be critical to the success of COVID-19 vaccination programs and the safety of health personnel, not least to overcome the trust issues that are often seen in vaccination campaigns happening in conflict settings. Just last week, we launched a joint appeal together with the International Federation to enable us to continue our vital COVID-19 response, including our efforts to ensure equitable access to vaccine. But our partnerships go well beyond the Red Cross and Red Crescent movement. Addressing the massive scope and scale of humanitarian needs we see today only can be achieved by seeking much more collaborative and innovative solutions with increasingly diverse stakeholders, from governments and partner organizations to the corporate sector and civil society. Indeed, we would welcome the opportunity to explore partnership possibilities with the HOPE Consortium, whose members bring together such a wealth of expertise in health, business, and logistics, among others. Our aim in this regard is to forge mutually beneficial relationships built on shared core values and collaborate in the development of innovative approaches to humanitarian action. The COVID-19 pandemic has shown us that global solidarity is not only morally right, but strategically smart. The worst could be yet to come for all of us unless we succeed in ensuring equitable access to the vaccine in every part of the globe. Let us hope that the spirit of humanity and unity, bringing different sectors together at this summit, will be an example for the international community everywhere. Thank you all for listening, and I wish you every success in your respective endeavors.
Thank you, Mr. Robert Mardini. Ladies and gentlemen, healthcare systems around the world have been rocked by COVID-19. As countries work to secure vaccines for their citizens and work towards a mass immunization as quickly as possible, healthcare systems are again tasked with an unprecedented challenge. This session brings together a diverse panel of experts to discuss how to best coordinate and overcome the challenges of a mass global COVID-19 immunization program. For our first panel of the day, I'd like to welcome Professor Nachman Ash, COVID-19 National Coordinator from Israel. Mr. Nadim Zahawi, MP, Parliamentary Undersecretary of State and Minister for COVID vaccine deployment in the UK. Dr. Farida Al-Hosseini, Official Spokesperson, UAE Health Sector Manager, Communicable Disease Department from Abu Dhabi Public Health Sector. Rashid Saif Al-Gbaisi, CEO at Rafid. And I'd like to invite Ms. Etna Trainer, CEO, eTrainer Media, to moderate our first panel of the day. Please welcome them.
And Yusuf, thank you so much. It's great to be here with everybody, and I'm really delighted to be able to join you today to bringing you this panel discussion on demand planning, really looking at preparedness and how we're going to overcome all of the challenges in vaccine administration. Now, I have a tremendous panel here, as Yusuf said, but let me quickly introduce you to them. We're delighted to have here from the United Arab Emirates, Dr. Farida Al-Hosseini. She is the official spokesperson here in the UAE for the health sector, but also the manager for Communicable Diseases Department with Abu Dhabi Public Health Center. So lovely to have you with us. I'm also delighted to be joined from Israel by the COVID-19 National Coordinator. Professor Nachman Ash joins us. Great to see you. We're looking forward to your discussion. From the United Kingdom, we have with us the Honourable Minister Nadim Zahawi. He is the Parliamentary Undersecretary of State and the Minister for COVID vaccine deployment for the United Kingdom. And I'm also delighted to be joined with the CEO of Rafid here in the United Arab Emirates. We're going to hear the great coordination work that they're doing also, Rashid Saif Al-Qubaisi. So thank you all so much. I'm really looking forward to this discussion. Dr. Farida, if I can start with you, and if you can bring us up to date in terms of what's going on here in the United Arab Emirates. We know how busy you all have been, so if you can bring us up to date with how are things looking here at the end of the first quarter.
Hello, Ethna. I'm really delighted to be here with you today and with the wonderful panel experts. With regards to the vaccination in United Arab Emirates, we have so far vaccinated more than 7.5 million doses that were administered across UAE. We passed 52% of the total population that are eligible for the vaccination, which is more than 75 per 100 across the country. The vaccination awareness campaign is still going on. We're targeting all adults 16 and above and educating different community segments about the importance of getting vaccination. We are providing them all the vaccine free of charge, and it's currently open access for all the eligible population.
Super. We'll talk more in detail about that in just a few minutes throughout the conversation. If I might, Professor, now talk to you in terms of what's happening in Israel. And indeed, when we look at the numbers, in terms of vaccination, I think we have to, congratulate you globally in terms of leading the way. So tell us a little bit about how you've managed to do this.
Thank you, Etna. We are definitely ahead with the vaccines. We have managed to vaccine about 5 million, more than 5 million citizens in Israel. Out of about 6 million are eligible for vaccination. Of course, we didn't vaccinate the children under 16. And this was done in only 3 months. So it was a really huge project during these last 3 months. We are out of our third wave. We had quite a big wave of disease during January. And since February and March, we are going down with the cases. And so it's much easier here in Israel. We managed to open our market and schools in the last month. So things look bright for the future here in Israel. We of course hope that we won't have another wave because of a new variant or things like that. We'll speak about it in the next minutes. What the key factors for success? I think the first one is leadership. We had a very good leadership. Actually, the leaders were recruited into this project in the HMOs and so on. The leaders were involved every day in this project. It's not like fire and forget. You have to deal with that every day. And logistics went quite good. We have a central command for the whole project. And we have a central storage point, deep freeze point, and from this point, the vaccinations are sent every day to the hospitals and to the HMOs, which are vaccinating the people all over Israel.
Yeah, super. And we can get into more of the details, and I'm really looking forward to hearing that, because it is very much, I think, the administration whereby other people can actually learn from perhaps, what you have learned along the way too, and speed up the process for many other people that perhaps might not be moving as quickly. Honourable Minister Zahawi, if I can talk to you now and look at what's going on in UK as well. Of course, keeping you very busy, so great to have you here with us.
Thank you very much, Etna, and it's a delight to be with you today and to share some of our experiences. We have vaccinated with the first dose, as of yesterday, 28 million people. And if you include second doses, we're over 30 million doses already. We began deployment on the 8th of December with the Pfizer-BioNTech vaccine, and on the 4th of January with the Oxford AstraZeneca vaccine. And our aim, our target, is to offer the vaccine at least one dose to, we have a list of 1 to 9 categories that was essentially decided for us by the Joint Committee on Vaccination and Immunisation, the experts in the UK, and we will offer that vaccine to all those 9 cohorts by the middle of April. That's 32 million people, and then the rest of the adult population by the end of July. We speak to our counterparts and friends in the UAE all the time, of course, to our colleagues, ministerial colleagues in Israel. Also, and I want to congratulate both of them on a tremendous job. We learn much from one another. Last week, we hit a record of 27 jabs a second in the United Kingdom. And so we've built an infrastructure, a deployment infrastructure that can do many, many more doses as we get the supply coming through. But I'm sure we'll discuss all of that in today's session.
And indeed it is. It's about keeping up with those. But jabs per second, I managed to get one of them myself last week, and it took about a second. So it's the efficiency, and we'll talk to Dr. Farida on this. This is, I think, again, the confidence that people are having when we look at the efficiency that's put in place. Rashid, now, of course, you have to coordinate a project like this, and RAFID was put in place to actually do that in the United Arab Emirates. And also, to pull together the concept of the HOPE Consortium and all the great work you're doing for that. So it's almost a double challenge. Talk to us a little bit about how things are looking for you, Rashid.
Yes, first I'd like to get the experience and expertise from other countries. And as a RAFID is a key stakeholder on HOPE Consortium, provide the services of warehousing, the vaccines, logistics of the vaccines, and making sure distribution of the vaccines for the whole health facilities, health centers, and the space where our the vaccines centers that will distributed across UAE, Abu Dhabi. So it was a big effort being done here to prepare the warehouse, to facilitate the whole plan around logistics and around delivering that vaccines to the health facility centers and the hospitals across the UAE as I said. So this is, I think, as a group purchasing organization, Rafid play a key role in that. Yeah.
Super. And again, we'll talk a bit more about the logistics and the challenges that actually presents from time to time. Dr. Farida, when we're looking at work, and the rollout for the vaccine programs, I mean, again, I think without a doubt, and people in the UAE, and that's where I'm living at the moment too, I think we can see the speed, the agility, the efficiency of the program, and we see it day by day, and we see how it's rolled out here. But how did you take into account, what did you take in when you were looking at demand planning, so to speak?
Definitely, the preparation for vaccination rollout happens months before the start of the campaign itself. I think one of the key success factors is the capacity of vaccination that you can do per day, and this really requires the collaboration between private and public sector. So we have been engaged with the community ahead of the campaign. They were part of the clinical trial that happened in UAE, so they were aware of the study and they were prepared that the vaccine is coming. And then with the rollout, the private sector worked hand in hand and the public healthcare providers. So we were able to expand our capabilities to ensure that we are vaccinating huge numbers every day. Also, when it comes to providing the vaccine outlets, we try to ensure a good access for everyone, including different workers. They might be busy, so we had to send teams, field teams, to provide the vaccine and ensuring all the processes were up to the highest level of quality. We also introduced new models of vaccination rollout, such as vaccination drive-through, and also we were vaccinating in majlises. Those are kind of social halls that were used for social events previously, so we converted them to vaccination clinics at this stage. So this helped us to really be in a race with time and try to vaccinate as much as we can in a short period of time.
It is indeed. There's a great urgency here. There's a great speed needed about making sure that it's very effective and efficient. Professor Ash, when we look at the work that you've managed to do in Israel, really, as you look at, I think, per capita, the world leader per capita in terms of vaccinations. UK has the big number there, but and I suppose in many ways, yes, we just looked at it's good. It's perhaps a smaller country, but per capita, you really managed to do that. Any of the challenges in place that you might be able to help if other countries are looking at this, because not everybody has been able to roll it out with such great speed. So, Professor, if you might address that for us.
Okay, so I think the first point is that we have a central command for this project. And they were planning and they were rolling it out like every day. The plan was for the next day. How many jabs are we going to give next day? And then the vaccines to every point that should do this. We based our project on our 4 HMOs. We have 4 HMOs in Israel. For healthcare system that they are used to vaccinate influenza every year. So it was easy for us to base it on them. And like as every citizen in Israel should belong to one of the HMOs, they could access every patient in Israel. So the planning of every day of the number of jabs that are going to be given next day and then spreading it to the different places. And one of the key points that we wanted to go to every village, to every city. So we have to spread our vaccinations very largely all over Israel. Although a small country, it was a challenge. And one of the things is that we have to split the packages. The vaccines come in large packages. We have to split it to many, many places all over Israel. And one of the most important things is, of course, the public opinion and dealing with the public opinion. So people would like to come and get the vaccines all around Israel. We're dealing with fake news and everything that I believe you are dealing with that as well. So we have to recruit the public to come to the clinics and get vaccinated.
Absolutely, and that's a whole other topic I really want to take a minute, just in a few minutes to really talk about the communication. But at the moment, let me just stay with the planning element of this too. And when we're looking, if I might minister to, in terms of the planning that has to go into this. I mean, sadly, some people still have to actually get hospitalized if they have COVID-19. How do you keep the infection rates lower, the hospitalization rates lower, and really build that robust vaccination process?
So we obviously, at the December point, went into quite a severe lockdown in the United Kingdom. So pretty much everything was shut down, including people having to work from home only if they really need to go to work could they leave their home. So the non-pharmaceutical interventions that we had to sadly apply because of the more infectious variant that we were hit by in December meant that severe lockdown had to be in place. But we also knew that we were getting very close to the approval of the vaccines at the beginning of December. And we began deploying, as Israel and the UAE did, the Pfizer-BioNTech vaccine. We built an infrastructure deliberately much bigger in terms of its ability to vaccinate than the supply that we were due to take in. So we brought together, at the heart of this is our national health system, the NHS, but with it, the armed forces. So two great institutions, effectively, the NHS and armed forces integrated together. So 101 brigade, our logistics brigade that would normally deliver supplies to Afghanistan and Iraq and elsewhere for our armed forces, was integrated into the logistics system. The NHS, GPs, nurses, pharmacists, hospital hubs all came together. And so we started deploying in the hospital hubs, then through primary care networks, GPs, 5-6 GPs in an area with a population of 30 to 50,000 would decide who the others would support. They started deploying. And then we built the national vaccination centers as well. And again, like Dr. Farida, we were imaginative in how we did this, especially to reach the hard-to-reach groups. I launched the Uptake Strategy on the 13th of February to look at how we improve uptake amongst ethnic minority groups and, of course, taking deprivation into question. So we've had pop-ups in mosques and in gurdwaras and in community centers and shelters for the homeless across the United Kingdom to reach those hard-to-reach groups. The priority, of course, was the 1 to 9. So group 1 was the residents of care homes and those who look after them. That was very much the delivery of primary care. The GPs were tasked, and we amended their contracts to allow them to do that work at scale, so that by the end of January, pretty much all residential care homes for the elderly were vaccinated, including, of course, offering the vaccine to their staff. And then the over 80s and health and social care frontline, then the over 75s and the over 70s and the clinically extremely vulnerable and then a very important group, which is cohort 6, which we are now continuing to reoffer to, which is about 7 million people, which is 16 to 64-year-olds with underlying health conditions, and then 7, 8, and 9, and 9 is the over 50s. So it's by age that we are deploying at scale in the UK. When we finish phase 1, we will be into phase 2, which goes all the way to the obviously the 18s and over, so the under 50s all the way up, all the way down to the 18-year-olds.
Yeah, and I think one of the key elements, and I think I've seen it around the world in this, is that concept of organization that you have put in place, and that there is a strategy and there's a policy, you know, and because it can't be rolled out for everybody immediately. So therefore, you actually have to make sure that it's not quite staggered, so to speak, but it is priority-wise. Rashid, when we look at all of the work that has to be put into this, logistic coordination, I mean, this is absolutely at the very heart and the very key from what we're hearing from everybody there in terms of how this is managed. Talk to me a little bit about how you manage the logistics of such a huge operation, you know, looking at it particularly for the UAE, but it might also give us a feel for what other people have to do in terms of managing the logistics and getting the vaccine rolled out.
Yeah, first is the capacity of the warehouse. So what Rafid did is create Rafid Distribution Center. It's a big, one of the biggest cold room warehouse, and that was our platform we start from. So we have a capacity to store big numbers of vaccines at that store. So centralizing that capacity and storing that vaccines help us to centralize the effort in one as a storage. Then we coordinate with the health authorities here in Abu Dhabi and UAE to find out where the places that we need to deliver the vaccines, to have there also some data about the forecast, how much we should deliver in each locations, which is very important for us, so we can provide the suitable vehicles to transport that vaccines to the locations. Also, it was very important to identify the quantity that we go to each location. So it will help us to provide the right vehicles and the right tools to provide it, because as Dr. Farida mentioned, we have plenty of vaccinations locations in UAE, and they have different type of service providers. Some of them will be drive-through, some of them will be health centers, and others will be hospitals. So for every single or for every category of these vaccination centers, there could be a vaccine or a storage, portable storage for these requirements. So this is what we did from Rafid in terms of the capacity or the storage and the capacity challenges, and we overcome that challenges in really very short time. Another important aspect in this is really the forecast and the close coordination with the health authorities, and they provide us with the right numbers, and by that we build a data analytics during the time of that distributions and help us to provide on a daily shipments and on scheduled shipments and others.
So clearly technology played a very, very big role too in this. And again, you know, using that data and using the analytics and being able to make sure that you can actually turn that technology into something very useful for everything. I imagine that was a bit of a challenge as well.
Yes, it is. It is. You're right. It's the heart of the logistics. So technology is very important to us. And we partner with Makta Gateway, with our partner, with our strategic partner, which is Equitable's Logistics Arms. And they provide us with all the support of that technology and with that data, and help us integrate all these data in one daily report showing the trends and how we should comply with the distribution needed to these centers or to these locations.
Professor Ash, if I may bring you in here in terms of talking about the technology, and I think it's something you will all be able to address for us. How important was this? Because so many players have to be involved in terms of getting that technology right, that talks to each other, and that ultimately delivers, a very efficient and effective rollout system. Talk to me a little bit about that, and perhaps maybe also how you might, work with the UAE and technology in the future, perhaps.
Yeah, so from this discussion, I learned that we have the same challenges and also very similar solutions. So using the data for rolling out this operation was very important. And actually, we had to know every day what number of jab vaccinations we have to give for the field to vaccinate. And also, we learned every day how many vaccinations were done. We could analyze the places where were lower with vaccination rate, and then think about the solutions for these places. And so the data was very important. Like I think in all this pandemic, we used a lot of data. So getting the data and analyzing it and learning from this what kind of solutions we should be given to the field next day was very important. And actually we're doing it till this day. And we could learn where are the weak places that we have put more effort. And about the collaboration, I think that should be done. We, as I said, we have the same challenges, we have the same solutions that we think of. So we would like very much to collaborate with the UAE and other nations, and especially thinking about technology. Not only technology regarding the vaccinations, also other things that should be dealt with such a pandemic, like trace, test, and protect technologies, the different technologies that can be used. We are thinking about it. So it will be very helpful to collaborate in these manners.
Dr. Farida, when we think of, the pandemic happening at 2021 and I suppose the progress in technology, if one thing, it has been particularly helpful. I mean, here in the UAE, I can talk for it, it's almost like there's an app for that. And I'm amazed to actually see the coordination, with the details from the health departments and, what's on the app and everybody talking to each other. So how has technology actually helped maybe make things a little bit more manageable, if nothing else?
Definitely technology and infrastructure is one of the key success factors for rolling out a good vaccination program. So being able to monitor the daily progress is important. Getting connected with the individuals and providing them with electronic record is extremely important. So today we were announcing during this week the announcement about the Al-Hisn app being the national electronic registry available as a documentation that can individuals use wherever they go if needed to show that they took the vaccine, what type of the vaccine, and others. So technology is important, but also the ability to use the technology in a very flexible way to adapt with the changes and needs over time. And this is an extremely important way of dealing with the community. So enabling them with the technology as well is a very important factor. Following up the safety of the vaccine network, using the technology to connect with the individuals and with also have professionals to report any side effect have been really from the beginning of the campaign rollout here in UAE. So it is these days we cannot really work without technology.
Absolutely. And Minister, I know if you can measure per jabs per second now, obviously that technology is helping to keep everybody informed. But again, we look at that technology, and while, in the modern world and in the developed world, this is, a great assistance to everybody. What can you also learn from this in terms of the data it is giving you that you can perhaps, use in the future to make sure that this is not happening again, and also perhaps to help less privileged countries too?
Very much so. So a few things to say on this. One, obviously, the success of the deployment program is also very much predicated on the engagement with the private sector, not just the manufacturers, of course, of the vaccines, but also on the distribution side. So we went to Boots and Superdrug, one of our two major chemist retailers in the UK, to use their distribution arms for the cold chain and for the AstraZeneca movement. And the front end, as we call them, the pizza boxes, are delivered to our GPs by DHL. But technology is embedded through the whole process. So we are very close now in the UK to allow our front end, the vaccination sites, to be able to track their shipments the way you track your Amazon delivery. But also in terms of analytics, we partnered, the NHS partnered with Palantir. So our data analytics is based on the brilliant work of Palantir to allow us to be able to forensically look at how we are administering the deployment infrastructure, but also we've gone further. So we now have a tool, a piece of technology that allows us to see by postcode the uptake, so that we can really focus on those hard-to-reach groups, whether it's the homeless, which I was mentioning earlier. We have a plan to vaccinate all of our people who are most vulnerable rapidly during that first phase of the vaccination program. It's those sort of tools that you can use, and we want to share those with the rest of the world. So we're very proud that the Oxford AstraZeneca vaccine is being manufactured at scale. I think about 300 million doses being made at the Serum Institute and elsewhere in India to deliver to the low-income and middle-income countries. And it was great to see it arriving in Ghana and in the Philippines and the Ivory Coast, but also for the Pfizer vaccine. And Albert Bourla has done a brilliant job of vaccine equality, of equity, of delivering that through COVAX as well. And what we've been doing there is sharing how we deliver that, because some of these countries just don't have the capability. And about 2 weeks ago, we also announced a big initiative at the G7 with our presidency of the G7. We are one of the leading countries for gene sequencing. So we account for just under 50% of all the sequencing being done of the different variants of the virus. And we've made an offer to the whole world where we will do the gene sequencing for those countries that don't have the capacity and the capability. And we're just beginning to operationalize that from both a physical but also technological point of view, so that we keep a library of all the mutations. So we're always ready. It's part of our plan to future-proof ourselves and the rest of the world against the COVID-19 virus.
And I think that is so essential. I mean, it's great news to hear that actually you're leading the way and making sure that that's in place. And I'm sure, you know, many other countries will be welcoming that. Rashid, when we look at the work that the HOPE Consortium is doing too, also in terms of, you know, making sure that deliveries are coordinated and that the data is there, talk to us about how, you know, RAFID can leverage the data and the analytics to actually, you know, contribute ultimately to the success of the HOPE Consortium and the aims and the targets.
Yeah, as a RAFID here, we leverage the knowledge, and as I said, it's the heart of any global logistic response to the pandemic. So having the data will enable you to set the right plan, be ready for tomorrow. So by having the data and the accuracy of the flow of the data within your capabilities, then you are easily going to be able to plan for the next, like, week shipments, coordinating that shipments, also plan that shipment. You need to do it by only vehicles. You need an airplane to be ready for that. Also coordinate the flights across the airlines and the countries, and making sure that it's in line with your protocol moving of that vaccines. You know, the vaccines storage vary between 2 Celsius to -80 Celsius. So these two variables is a challenge, and need good and planned point to move these type of vaccines across internationally, as an example. Internally also, this is need to be, the data is helping us to secure these shipments on a timely basis and deliver it to the right locations on a timely basis.
And indeed, yes, a timely basis, and making sure, as you say, that, you know, the refrigeration is in place, that the correct temperature is there to make sure that the vaccines, when they arrive, are in the absolute best condition. I think, yes, coordinating all of that. And Professor Ash, if I might pick up on something that you had mentioned there earlier too, in terms of, you know, making sure that you bring everybody on board. I mean, around the world, there are still people out there who perhaps don't have as much faith as perhaps you and I do in this group here in terms of getting the vaccine and actually believing that this is what they need to do. How are you managing, you know, as a country with your people to win these people over? And how do you make sure that you actually get a strong and get the right message out there to the people in Israel?
Again, the first point, first, it's a huge challenge, yes, for everybody and also for us. The first point is, again, leadership, and you should have very strong professional and unprofessional leadership that should work in bringing people all together. The second thing is to have vaccine ambassadors, kind of vaccine ambassadors all around Israel. You recruit the people who are opinion leaders that can influence other people. So if you want to influence the young people, you should get the opinion leaders for the youngs. And then we had to incentivize the people, and we were doing it by creating a green pass. And this green pass today in Israel can offer you to get into culture places, sports events, and so on. So if you are vaccinated, then it's very easy for you to get into, because you have the green pass. If you are not vaccinated, you should be tested, and that will take time and not enough tests and so on, PCR tests. So having the green pass created a huge vibe in Israel for all for vaccinations, and I think this was one of the key points, key success points that we had.
Dr. Farida, when we look at the concept of, you know, leadership, particularly in the UAE, and I did notice that it was indeed many of the key leaders who very publicly made sure that they had their vaccinations. And, you know, we saw lots of video, and we saw lots of processes and pictures about them. I mean, the leadership is absolutely essential, but also bringing together this concept of maybe ambassadors, but, you know, pulling together all of the departments. I mean, government has to work together on this to make sure that everybody else comes on board. What do you think?
Well, I think that awareness and engagement with the community is one of the key success factors. And to do that right, a good understanding of the community perceptions, doing some surveys, understanding what are the concerns that you have in this community. And it's not really a new challenge. For every vaccination campaign, we noticed that the anti-vaccine groups were really trying to mislead the community, sharing a lot of stories that could create lack of trust between the community. So basically, having a good understanding of what are the perceptions is very important to draw your plan and really target the pinpoint, the pain points within your community. Also, as you know, UAE has really a very variable community segments from different countries across the world. So addressing the messages, the right messages for every segment is very important to ensure that this message is not really reaching only small community members, but also wide. So using different languages, using social and traditional media. So using kind of a mixed types of media is very important. Also using community and support of the community leaders to support. Definitely definitely our leadership being a role model has really helped us to spread the message around and to get a lot of people vaccinated, but also addressing the concern that might people doubt about safety of the vaccine, relationship of the vaccine to certain conditions like autism or any endocrine. So those kind of worries, we were trying to measure the pulse of the community and try to react immediately and address all of those concerns. This is definitely is important, and it will vary from community to community, but it's really important to be dynamic to address all the challenges and the perceptions that, or the misperceptions that are within the community to ensure that the message, the right message is there.
And Minister Zahawi, when we look around the UK too, there are still, areas that maybe people are not as convinced, and people, there's frustration there. I mean, this is all of, sadly, what you have to do in a day's work. I mean, how are you managing to do that, and how are you coordinating, with your other colleagues in government to make sure that you can actually, get the right message out there and bring people on board? Because this, you talked about that, and you talked about the uptake, as you say. So you're obviously successful in some, but there's still more work to be done.
Very much so, Etna. So in many ways, vaccine positivity in the United Kingdom has never been higher. If you compare this vaccination program to, say, the flu vaccination programs, we've already essentially smashed all the records in terms of uptake of the vaccine. And I think partly because of the strategy's always been to be transparent. If you recall, we were the first country to, one of the first countries in the world, certainly, to approve the Pfizer-BioNTech vaccine. And on that day, it was our regulator that was on television at the press conference sharing the data and exactly how they went about doing their work. No corners cut, no shortcuts, simply paralleling all the 3 phases, because money was not an issue, of course, because of the pandemic. And again, we did the same thing in January with the Oxford AstraZeneca vaccine. We have also our community champions, similar to what the Professor Ash was talking about in Israel. We have put about £23 million to identify people who are, focal points in their communities, faith leaders. We had a brilliant vaccination program, which I attended myself, with a brilliant group. They're called the Hatzolah First Responders Ambulance Service for the Haredi Hasidic community in London. And they are a trusted voice. So we partnered with them, the NHS and local government. They led. And on a Saturday night at 8:30, we vaccinated 364 people, not only from the Haredi community, but also Muslim families in Hackney were coming forward to be vaccinated by the Hatzolah vaccinators. A brilliant, brilliant initiative. We've done the same in the Abbas Mosque in Birmingham, and in the Brent Mosque in Brent, and in the Jesus Church, which I attended with the Prince of Wales. So we have a whole strategy based on evidence, as Dr. Farida talked about, because we do a lot of research here, that if you make the vaccine accessible at a time that is convenient for people, at a place they trust, then they will come forward and be vaccinated. Now, in saying that, vaccine positivity is at 94% in the UK. When I took this job on in November last year, it was in the high 70s. So we've done really well. 94% of the adults say they are very likely or most likely to take the vaccine. But the 6% skews heavily towards BAME communities, the Black and Afro-Caribbean community, Bangladeshi, Pakistani, and others, which is why we have such a strong uptake strategy to focus on those communities. But also, we're doing the same for the rest of the world. So through our presidency of the G7, we are working with many universities around the world, including Harvard and others, on a vaccine positivity communication campaign with the largest social networks in the world, because there is a tsunami of misinformation, disinformation, anti-vax information. And again, to your point, Etna, we coordinate across government. We stood up a unit in the Cabinet Office last March 2020, that works with the social networks on flagging disinformation, misinformation, and asking them to take it down rapidly. And that seems to also be working well. But it's a constant focus on uptake. We've translated all of our information into everything from Arabic to Farsi to Hindi to Gujarati to Polish, so that all the information is available in all the languages of the different communities that reside in the United Kingdom.
Yeah, indeed, and it's a non-stop effort. Dr. Farida, talk to me about the role of the media in this. And in fact, I think it's something you can probably all put in. And we're very used to hearing you on the radio, on TV. You're bringing those updates. And here in the UAE, definitely, I think the updates have been non-stop. As a resident here, I have felt very informed all the time, and I know everybody else is too. But how important has it been, that cooperation with the media in terms of getting the message out?
Well, the media are really partners with us in the vaccination campaign, and this partnership is really very valuable and important for our messages to reach the community. We are using different types of media, including the traditional media, TVs, radios, but also untraditional means to reach the younger population using the social media platforms, different platforms as well, because this is really where the misconception about the vaccination are there. So it's very important to be present in the non-conventional ways as well, to ensure that the right message is reaching different segments of the community. So we do have a central media workforce that help us in laying out the messages in the vaccination campaign. We have launched take a lot of campaigns to address this. There were two focuses. The first one is to the high-risk groups, because they are tending to be also the top priority, but they tend to be more reluctant because of their conditions. So having the time to focus on this group was very important, and you could see that mostly during the month of February, our focus was mainly on this group. And in addition, we had from time to time, and currently we are focusing on different and wider segment of our community as well. So definitely they are a very important partners with us.
Now, Professor Ash, I mean, obviously this is still headline news, and it should remain headline news. And as a former journalist myself, you see, the world is still in crisis mode on this. The media is so important on this, Professor. How has this made a difference? How has it helped you to do your job?
Well, recruiting the media is key for success, and I think it should be that first leaders, professional leaders, should be in the media all the time, like every day, speak about vaccines, speak about their important role in getting us out of this pandemic. This was done by different leaders, professional, non-professional, all the time. And then, as said by Farida, you should find the appropriate media for different parts of the community. It should be like Haredic media is special, and Arabic media is special, and young people media is different. So you should fit it to every part of the society, and you should be there all the time. And then you should be proactive and also reactive to fake news and things like that. You should never leave the field for other players. You should be there all the time.
And Minister, I mean, when we look at, the media coming out of the UK as well, I mean, you all have very serious jobs to do. And this is, over and above keeping everybody informed and the speed at which you have to do it as well. But, as the professor said there, you have no choice, and they need to hear from the key people. You can't just appoint someone else to deliver your message. How important has it been to work with the media to make sure that everybody's getting the message?
It's incredibly important. Obviously, we have a strategy to make sure that we share all the data. So we publish daily data in the UK of our number of doses, but also sadly of how many people have died from COVID or have been infected with COVID. And when I begun this deployment, we began sharing top line data, and now we go into real detail, including ethnicity, so people can see by constituency. So every member of parliament can see what is happening in their constituency in terms of their data. So, data is my ally in this endeavor, because I think it's been such a sort of cross-party effort in the UK. And I have to say, every political party has come and played their part, and the metro mayors, whether in London or Manchester or Birmingham, doesn't matter if they're Conservative or Labour, have come together to help in the deployment. We've had some really great videos made that went viral through the social media of MPs of Black and Afro-Caribbean background from all parties saying, they've either taken the vaccine, or when it's their turn, they will take the vaccine. And the South Asian community MPs as well doing the same thing. So it is a joint effort. And of course, there's very, very wide interest and deep interest in our media into the vaccination program. So it's followed on a daily basis in the UK. And it's been quite, I'm going to say something quite philosophical here, Adna. The virus has really challenged many liberal democracies around the world, because when you're withdrawing people's freedoms, it's never easy. But the vaccine, I think, in many ways, has helped us demonstrate to the world what I think we're pretty good at. We demonstrated in 2012 with the Olympic Games, and that we're good at organizing. It's that sort of Dunkirk spirit, the 1,000 flotillas coming together and saying, we want to make this work, we will deploy. 80,000 volunteer vaccinators have joined in the effort to deliver the vaccine jabs, 200,000 vaccinators to make the experience, especially for the elderly, because we began with the oldest people in the UK, to make their experience of coming to a vaccination centre really pleasurable and simple. So we've had incredible vaccine positivity, shared, of course, by that pipeline, which is, and I'm going to point at you, Edna, you, the media, with the rest of the country. So it's been an incredible sort of endeavour, effort of the nation, the four nations. Scotland has done the same thing, Wales and Northern Ireland, as well as England, of coming together to deliver this incredible programme, and we will continue to do so. We're only about a third of the way, even at 30 million plus doses. If you do the maths, I've got to get to about 53 million people with 2 doses. So we're a long way to go still, but we are absolutely determined to do that and do it well, and help the rest of the world as well at the same time, which is equally important, because none of us are safe until we are all safe.
And indeed, I think, even the information that I'm getting here from everybody, can be such a help to everybody else who's looking and wondering what they have to do if they're not up to speed. Rashid, talk to me about the protocol systems, the procedures, that RAFID would have to make sure are in place to make sure that the transactions are efficient, that they're effective. And when we look at the procurement supply chain, that everything is in order to actually manage the magnitude of what we're listening to from everybody here.
Yes, it's very important that we develop all the standards to comply with the requirements from the health authorities around managing, storing the vaccines and distributing the vaccines. Our role was very essential to enable the health authorities to reach places where are very far from the centers, outreach places, also to help the authorities to reach a number that they are targeting to be vaccinated every day. So taking into consideration all these requirements from our stakeholders and our partners, Saha or Rafid role was to manage all these associated contracts and finance for all healthcare, like medical supplies and logistics needed to move the COVID-19 vaccine. Not only vaccines, it's vaccines plus the medical supply associated with this, the requirement gloves, as an example, that needed for the staff. Also, Rapid worked hardly to make sure that the network that's been planned and being put in place with the health authorities across UAE are mapped. It's a huge number that we need to ship every day vaccine to. So it's we can do this only through very clear protocol, agile system, flexible tools available for us to deliver all these shipments on a timely basis on a safe condition and control conditions. So as a Rafid, we are proud to be part of the HOPE consortium, so we can express our experience and what we did here internally to other partners internationally. Also, we are glad that we are part of the whole COVID-19 vaccination programs and the big achievement that happened within UAE.
Indeed, yes, and there's still so much to be done. And we're, sadly coming to almost closing up here, but we still have some time on this. And what I'd love to maybe get from you all really is when we look at the lessons that can be learned, by other countries. And Rashid, maybe just stay with me on this for just a minute. What do you think Rashid needs? What more do you need to do? Because this is not going to finish next week or next month. There's still a long road ahead. What do you need to do to make sure, that it becomes a smoother process from now on?
I think the most important thing is that you have a really solid approach in reaction to any near future. So preparing yourself to have very fast solution when it's required by the health authority here in UAE. So it's a solution that you can provide for your partner that will enable them to reach their goals and objectives about how much they vaccination, or as an example, the number of people need to be vaccinated within UAE. So the target is put by the health authorities. Rafid's job is to provide a solution, to provide an effective way that the health authorities will reach their targets. So I think to be very fast in your response and to have a solution fully taking into considerations to be fast, agile, and safe, and taking and adopting the standards that needed from these authorities.
Absolutely. Professor Ash, when we look at, and the great work that has been done, it's not a job that has finished. There's still urgency there. There's still making sure that the rest of the country is. And then there's still, sharing this information with rest of the people in the world that can learn from the challenges what you've put in place. Talk to me a little bit about what you think they can learn and how we can make this better.
Well, first is recognizing that the best solution for this pandemic is vaccination. And then you should put this vision of vaccinating all your people and then go with it and actually put all your efforts in this vaccination program. And while we look in Israel for the bright future of getting vaccinated and getting out of this pandemic, we still should be with our feet on the ground and see the threats that can come, and especially the variants that can threaten the vaccine. And we should monitor for that every day and look for new variants and then for solutions for these variants. And I hope that what we learn for the new technologies that we will be able to get fast solutions to new variants and deal with that as well.
Thank you. And Minister, when we look at, you talk about the work that you're doing already, helping other countries and that cooperation, which I think, has to be there. But what's most urgent for you right now to make sure, as you say, that, we deliver a global solution, perhaps?
Absolutely, Etna. So obviously we continue to vaccinate at scale and accuracy by targeting the most vulnerable, because the 1 to 9 categories is 99% of our mortality, sadly, in the UK came from those 1 to 9 categories that I talked about earlier. So in combination with the vaccination program is what the professors just talked about, which is surge testing. When we entered this pandemic, we could only do about 2,000 tests a day. We now do, last week we did 1.6 million tests per day. And so we have a capability to surge test by postcode to identify any new variants. And then, of course, genome sequence. We genome sequence about 30% of our positive cases. At the moment, we want to raise that even further, and then obviously isolate. And then for the future, we're future-proofing the program by obviously working with the current manufacturers on a possibility of an autumn jab, a booster jab, certainly for the most vulnerable communities, and then probably an annual vaccination. We've announced a very important collaboration with CureVac, which is another messenger RNA technology company that they will manufacture in the UK at scale. And then we have the Valneva vaccine, which is a French company being manufactured in Scotland for the end of the year, which will probably form our annual vaccination program. It's a whole inactivated virus vaccine, which the scientists have great hopes for in terms of dealing with any variants. So we're looking to future-proof our vaccination program against any virus variants that may emerge in the world and share that with the world. So we've put 548 million through COVAX. I mentioned to you the deliveries to countries like the Philippines and Ghana and Ivory Coast and elsewhere. That will continue. The Prime Minister at the G7 summit managed to get the G7 to pledge another 4 billion to COVAX as well to help the rest of the world. And so we continue to want to share excess doses as well. He made an announcement at the G7 that any excess doses will be shared, the bulk of which will be shared through COVAX and, of course, through bilateral relationships. So we have always, from day one last year, back in April, when we launched the Vaccines Task Force, we had 2 priorities that were set for us by our Prime Minister. One is find the vaccines and contract them and deliver them and manufacture them in the UK. And the second is we must always think of the rest of the world and plan to help the rest of the world, which is exactly what we're doing.
It is, because ultimately we have to make sure that everybody comes out of this. It's not something country by country, and unfortunately, we've got to make sure that we all get through this. Dr. Farida, I'm leaving you the closing word here. There's still so much work to be done. I can hear it in other countries here, but here in the UAE, the planning that you put in place has got us so far. What do you see so urgent now that we can move and make sure that there is global unity in eradicating this COVID vaccine or the COVID virus?
Actually, we believe that it's not enough for one country to succeed in the fight for COVID. It's basically the collective success of different countries. So UAE is very committed to support the international community, to support countries who are in need of support. The launching of HOPE Consortium is one way where we can enable countries who need support in the logistics and in the transportation. But definitely we also work with COVAX and with the international community to provide all types of support to other countries. We are open to learn and share our experience, and whatever investment that we are doing today is not only for fighting COVID, it's basically an investment for the future, because definitely after COVID, there might be any other diseases that we need to be ready for. So this is a learning process, and this is an investment for the future.
Indeed, and I think the one thing we have all learned right around the world, how important our health is and how important it is to make sure that we all keep an eye on that individually, collectively and indeed globally. I really want to thank you all. It's been, a wonderful discussion here. I want to thank you for all of the value that you've added. I hope our viewers watching this have really found this very useful and have found tremendous value in it. Thank you also for taking the time. I know you are all, leaders in the fight against the COVID virus, and you're busy with your day job. So thank you all so much for taking the time to be with us here. So to Dr. Farida, again, thank you so much. We really value your time and effort and the energy you have put in here. Also to Rashid, to Minister Zahawi, thank you again. And Professor Ash, thank you for being with us. So from me, Ethna Trainer, and from this great panel that I've had, as I say to our dear audience there, I hope this has been of great use to you. So we have to hand back to the studio now and hand back to you. So thank you so much.
Thank you.
Thank you.
Thank you, Professor Nakman Ash, Mr. Nadeem Zahawi, Dr. Farida Al-Hawsari, and Mr. Rashid Saif Al-Qbaisi. And of course, thank you to Ethna Trainer for moderating this panel. Next up, ladies and gentlemen, we have a 30-minute networking break, and we'll be back for our next panel, which is coordinating vaccine logistics operations in the Middle East. Once again, I'd like to encourage you to network, visit the exhibition booths, and take time to engage in a collaborative discussions. We'll see you in a bit.
To watch all the sessions from the World Immunization and Logistics Summit, click the link